Welcome back, you beautiful people. It is another incredible Medshield Movement Connect show episode with me, Dr. Fez. Today we're going to be talking about what this month's particular awareness is, and that's injury prevention with somebody who knows how the body moves, a physiotherapist. His name, Thabane Nsibande.
Get ready to know what you don't know about being body brilliant. This is the Medshield Movement Connect show, where we connect the dots between fitness, health, wellness, nutrition, and of course you. Hosted by me, Dr. Fez Mkhize, and a special guest that we have every month, sharing knowledge, insights, and groundbreaking tips on how to get fitter, be stronger, and live healthier. Turn up the volume and listen close. Today you amplify. It's the Medshield Movement Connect show. Let's go.
Thabane, thank you so much for sitting down with us.
Thank you, sir.
Yeah, I mean, it's always interesting because one of my best friends, so we went to medical school together, and he's a physiotherapist. He is probably one of the most knowledgeable people I know when it comes to the human body and just health. And people tend to always ask, like, what's the difference between a medical doctor, a physiotherapist, and then they also will go into audiology, all of these concepts. But I always say we're all health practitioners, and you can find somebody who knows a lot more within a specific place when it comes to health, and somebody else who might not. But if you were to say what a physiotherapist is to somebody at home, just to the layman, how would you give an overview of what physiotherapists would do?
I normally say between the doctor and the physio, because that's what people say, they compare us to doctors.
Yeah.
We basically deal with the physical side of things, whereas the doctors prescribe medication and all those things, and we don't do that.
Yeah.
But we treat the same conditions that the doctors treat, and we basically had the same type of education as them. It's just that we don't prescribe medication.
And I love that you said you don't prescribe medications, because that's always also my big pivot. It's like they don't write stuff on the prescription pad, but you can have people who know how to work with like chest, who know how to work like all the different specialist type ideas that are there with medicine are also there when it comes to physiotherapy and interests that you have. And I think that's for me why it's always such a beautiful synergy between the two. It is kind of injury prevention month where we're trying to get people aware of injuries that they may have and how to kind of work through them or to prevent them. And I know you said you work with the physical element. When it comes to concepts that you'd be telling people who come to you who don't want to get injured, what are the general ideas when it comes to either working out, exercising, any sort of movement? What are the things you'd promote?
Yeah, so injury prevention is a broad topic. It applies to elite sports, just your normal weekend soldiers. It applies at normal working places. So obviously physiotherapy plays a huge role in trying to prevent injuries. It's just that obviously there's still a big gap between practice and science, because injury prevention is science. I mean, most people would say, why should I go to a physio when I don't have any injury? But we obviously need to play a huge role in terms of education. Most people are not knowledgeable enough as to what we do, basically. I'm going to start with your normal people who work at companies.
Are those the weekend warriors that you were
No, those weekend warriors would be the people who train mostly on weekends, or who just who run 10 kilometers a week and maybe run 5 kilometers on a weekend.
Okay, I just needed, because I was like, weekend warrior. What's a weekend warrior? Okay.
Yeah.
So let's go to the layman. Yeah.
So I'm talking about people who work at companies, who work in offices. They do a lot of bending, crawling, lifting, twisting, and with all those movements that they do, they basically need someone to sort of guide them as to how you need to do those movements to prevent injuries. So physiotherapists play a huge role. It's unfortunate that obviously in most companies, if not all companies, they wait until their employees get injured before they can send them to us. But they can actually save a lot of money if they had someone in house who would, advise their employees on what to do to prevent injuries.
Prevention better than cure.
Prevention is better than cure. That's for your normal working or layman's human beings. And then you come to sports, elite sports. You would think that most elite athletes, since they know that their livelihoods depend on what they do for a living, which is athletics or whatever sporting codes they're involved in, you would think that they'll be more proactive in terms of coming to us for injury prevention. But no, they still don't.
Yeah.
There's still a big gap that needs to be bridged. Yeah.
I think you know what it is, and it's funny that you say that, and the reason why I kind of am like chuckling and laughing as you say, it is that concept of unless I'm injured, I feel like I shouldn't need to go see anybody.
Yeah.
And that's even when it comes to dentistry. If my tooth hurts, I'll go see the dentist. Or if my vision isn't great, maybe I'll go see the optometrist. And it's that, I guess, that dissonance, that cognitive dissonance between that's kind of there with I want to prevent it, so I need to know the things that are going to make sure I'm preventing that injury. And the people who know that are the people who work within those spaces where prevention is front of mind.
Exactly.
So in your mindset, when do you imagine somebody should go see a physiotherapist? Do you think that it should be something that's happening annually, or is it you need to just be able to at least have somebody who you know, especially if you're somebody like me who works out and tries to train and do things on quite a frequent basis, that you have somebody who's your touchstone when it comes to that?
So, okay, let me start again with elite athletes. At least before every season, they go through pre-season. And it's easier for them because obviously during pre-season, that's when most of the injury prevention strategies are implemented. It's easier when we sort of include it in their everyday training schedules, and it can be implemented. So it's basically an everyday thing for them, or every time they go to training. For weekend warriors and for the people who train regularly, but they don't really take part in elite sports, I would say maybe once a month. Or, yeah, basically, but not even to say once a month. Okay, maybe I'm wrong there. Let's say before you start any physical activity, you need to at least consult with a physiotherapist who would go through a full body assessment with you and see where your shortfalls are, and then try and formulate a program for you that will help you obviously regain or perform at your optimal level, and then we can then create a long-term program where you go back to your gym routines and you include what we would have recommended to you. So yeah, basically before you start with any,
which I can definitely see that. I know that I say, sometimes I sit here and I almost feel like you're speaking to me as the person who should have done these things, and I retrospectively go, I probably should have done all the advice that you're giving. But now that I have you here, which is always good for me, and it's probably why all of you like watching this, because I connect the dots for myself, and you're probably thinking the same thing. When it comes to preventing injury, I know there's the concept of wanting to warm up your body before maybe you do an exercise, and some people will go, okay, static stretching before you work out. And some people, no, static stretching might be for something after you've worked out. To static stretch, maybe do mobility or a more dynamic movement. What are your ideas around concepts like mobility, static stretching, and maybe kind of like more dynamic stretches before and after workouts, to ensure that you don't end up injuring yourself, and especially over a long period of time, so that you end up making sure your body can recover and get primed?
It's funny because you basically mentioned all the stretching functions for stretching, because that's why we do stretching. We do stretching to prevent injuries.
Just so that everybody at home knows that I did go to medical school, you know, I just like keep up on the health stuff.
Yeah, we do stretching to prevent injuries, obviously, to improve blood circulation, to improve flexibility and mobility, to improve posture, and and you, like you said, you stretch and warm up before your exercise, and also after your exercise to prevent injuries. Obviously, the belief is that before your exercises or before your activity, you do more dynamic warm-ups and stretching.
Okay, so before. Okay.
Before, yeah, obviously to improve flexibility and improve blood circulation, and obviously to get your muscles nice and supple and be able to stretch properly. And then after your activity, then you cool down, and then you do your static stretches.
Which it just and I like that you agree with me in terms of that, because it's also when it comes to these kind of warm-ups, I know that sometimes it can be contentious and people will talk about, well, you do this before, the starting one before, and then you do the high performance, and then at the end you do something else. But I always find that, or would your idea be, at least if you're trying somehow to prime the body, that's the important thing, rather than specifically doing dynamic or static before. It's just priming the body, or getting it warmed up.
Yeah, one of my lecturers used to say there is actually no blueprint in physiotherapy. So,
boom. And I just wanted you to say that, because I feel like there's just discussions back and forth that I heard, and I'm always like, but I haven't seen a clear-cut study that is like the golden random controlled trial that finds that this is the optimal blueprint for how you end up priming for this. Yeah.
Exactly. We actually encourage athletes to do what works for them, even though obviously we will be there to guide them as to what they need to do, but we normally encourage them to do what works for them. It normally works better that way.
Oh, yeah, love to hear it. I'm still having you here. I'm somebody who does get injured. I think it's the old age. It's starting to catch up to me. When it comes to concepts around, say you're injured playing basketball, I like to play basketball, or kind of a boxing or soccer, and you feel like there's some sort of strain that's happened to a part of your body, say a muscle, your quad, whatever it may be. What are the thought processes around that acute or that like initial phase to make sure that you are starting to get the healing and the recovery kind of in that space?
So are you talking about someone who comes to us for...
So if I'm, let's say I'm playing a sport and I think that I've strained something, it doesn't feel overly painful, like I can still put weight on it, I can still kind of move it, but it is kind of aching there. What are some of the things that you could tell them they could do in terms of starting to assist with that recovery?
So obviously the most important thing in injury prevention is listening to your body, right? So as soon as you feel like you might have tweaked something, you stop and assess, right? It's normally very tricky with inexperienced athletes or people who just started training, because they would not have experienced such injuries before. And it's obviously for experienced athletes, they would
know the
probably,
process,
they would have experienced it before, and they would probably know what it could be and what they would need to do about it. But for your everyday...
us laymen, us lay people.
Stop what you're doing and assess the situation. Is it getting swollen? Is the change of color on the part that is affected? Is it affecting your movement in any way? Obviously, the first thing, I'm sure you've heard of rice before.
Yes, I have actually, and so go ahead, because
rice. So rest, ice, compression, and then elevate. Yeah, and that's basically the first step you do.
So the resting, fair. You said stop, assess how it feels, and then the ice. in terms of the icing? Does one just...
So as much as inflammation is a good thing,
Mm-hmm.
but you also you don't want to get too inflamed, basically. So you wanna try and encourage blood circulation as soon as possible, and to obviously prevent swelling.
So that, and this is the concept. I know most people like, why are we putting on the ice? It's because of the fact that you don't want it to get too swollen too rapidly, and then the blood isn't actually allowed to go in because there's too much pressure there.
And also compression, like I mentioned, which will then help with the positive blood flow.
And I mean, if you're putting some, like an ice pack on it, does that also technically count as a kind of some compression or some sort of physical compression?
Definitely,
That's it?
yeah.
Great. And then elevation. So this is my thing. How does one know that you've elevated enough? What's your...
I think scientifically there is an angle that you're supposed to put it on, but
if I'm at home, because I know I've heard in terms of the heart, is that the reference point?
yes, actually, yes.
Yeah, is it in terms of kind of, so you
45
try to...
degrees or something?
45 degrees, so like a pillow if I'm injured on the leg, and then lying
because
flat.
when you elevate, it has to be above the heart, yeah.
So it comes back and kind of moves through, which again, it's always funny because I go, these things seem so simple and trivial, but I know in terms of long term, if you can do the initial stuff, then long term your recovery might actually end up being a bit more kind of streamlined than if you just left it and it got very swollen, and then the circulation isn't going in and the healing then slows down. In Injury Prevention kind of month, what is it that you would say in terms of the things you should have on hand once you have an injury, people should know? So is it the numbers of people? Is it understanding, of course, the RICE concept? Like, what are the key take-home messages, just so we can have it wrapped up nicely in a beautiful bow for us?
Okay, so like I said earlier, the injury prevention is a learning process. You have to understand when you're injured and not injured, right? You have to listen to your body. That's very important. Listen to your body. What else can I think of?
Have a rehab individual or a specialist who knows about physical health.
Yeah,
you should at least have as a contact. Yeah,
come and see us. We'll obviously guide you as to what you need to do.
I'll take 3. I always tell people, generally, when it comes to anything quick fire or succinct, 3 things are the things that you'll need. Everything else ends up complicating things.
Yeah.
So I love that we're still finding the synergy between health practitioners who work in different types of disciplines, and if you're sitting at home with an injury, have you riced? Have you seen your physiotherapist? Because if you haven't, you really do need to, because I feel like, what are you doing with yourself? What are you doing with yourself? It's been another incredible episode with me, Dr. Fez. It is Injury Prevention Month. Try to not be as hard on yourself. Have a little more recovery day. Take it a bit easy. Maybe a few more rest days this month. Take your time, and we'll see you on the next episode of Medshield Movement Connect show. With affordable and value-packed options tailored to meet individual and diverse family needs, Medshield Medical Scheme has confirmed its position as a healthcare partner for life. For more information, visit www.medshield.co.za.